Good morning, everyone. It's 11 a.m., so we're going to go ahead and get started. It is my pleasure to welcome everyone to our 2021 Dissemination and Implementation short course. This is day 2, where we're talking about balancing cost and value using practical implementation methods. If you're having tech issues, please contact our Launchpad by email, di-launchpad@ictor.wisc.edu. My name is Heidi Brown. I'm an assistant professor in the Department of OBGYN, and I'm one of the faculty members of the D&I Launchpad, and I'll be your sort of moderator for the day. Some quick housekeeping things. Participants' videos and sounds are not on in our webinar platform, which is what we use in the first half of the day. It is a jam-packed agenda. We have several 15-minute breaks scheduled throughout the day. Please take advantage of them. The times on our agendas are all Central Time because that's where we are. This course has been outstanding, and that's because of our speakers and volunteers. We're really grateful to have all of the amazing folks on the team making things run as seamlessly as they have so far. There are 2 different functions in our Zoom. There is a chat function and there is a Q&A function. The chat bar is a great place to place resources or ask questions about, I'm having trouble getting this or that to view. If you want to post a question for our speakers or panelists, it's best to put it in the Q&A box. Please complete our post-course feedback survey that will be emailed later this afternoon. I can't tell you how much time we spend actually going through the evaluations and building the next year's course based on what we learned from this year's course. So we really do read them. It's really important. And many of you are researchers and know the importance of evaluation. So I'm going to start with what we thought were key takeaways from our full and very exciting day yesterday. We were so grateful to have Dr. Ahrens present to us about EPIS. And we discussed how very adaptable and flexible it is, and how if you adjust your view just slightly, it's like a kaleidoscope where suddenly you're looking at things in a slightly different perspective. We talked about the layers and levels within implementation processes and within all of the phases, the exploration and preparation and sustainment phases as well. We talked about the importance of bridging factors that really link and facilitate the interactions between the inner and outer context and how those things blend and evolve over time, as well as how context and determinants evolve over time. So the key takeaway from our perspective is there's so much we can do and so many important questions that we can answer and tasks that we can plan using EPIS with its flexible and adaptable approach. Today, we're going to start out with our second featured guest speaker, Dr. Lisa Saldana, who's going to give us an introduction to SIC and COINS. We are going to then have our first break for 15 minutes, and we're going to come back to hear from 2 panelists, Jay Ford and Andrew Quanbeck, and I'll give you a little more information about them before we start that part of the session. And then there will be another 15-minute break before we switch from this webinar platform that we're in this morning to a Zoom meeting platform where it's easier for all of us to turn on our cameras and unmute, and we can interact in smaller breakout groups. I highly encourage you to attend the interactive breakout session this afternoon. As adult learners, we all cement our knowledge best when we're able to apply it, and that's the purpose of the afternoon session, a smaller group of people. We have some folks from Dr. Saldana's team who are excited to join each breakout session and help us facilitate. And then we're going to close so that you're not tempted to just turn off at the end of 2 long days with emerging topics and exciting new work and what's happening in the field. So we encourage you to ask questions and be freely involved throughout today. We're very excited, and we're going to kick it off with Dr. Saldana. Dr. Saldana is a senior scientist at Oregon Social Learning Center, and her research emphasis is on evidence-based practice in public serving systems. Her clinical and research emphasis addresses needs of families involved in the child welfare system. She is the primary developer of the stages of implementation completion, or SIC, as well as COINS, the cost of implementing new strategies. And SIC and COINS are tools that can help us measure implementation processes, milestones, and resource use. SIC and COINS have been used to track almost 2,000 implementations of behavioral and physical healthcare programs worldwide. And we are so fortunate to have Dr. Saldana here with us today to speak with us and then to give us feedback and join and help us learn how to apply these tools in our work. So Dr. Saldana, I'm going to stop sharing now so that you can share your screen. And we look forward to hearing from you.
Great. It's not letting me share quite yet. Just a moment, please. Oh, there we go. Wonderful. All right. Thank you. Thank you so much, Heidi. Welcome, everybody. Welcome this morning. I'm delighted to be here. I just want to give a little bit of background before we get started. And to let folks know, for people who have heard me talk before, I went back last night after our conversation. We had such a great conversation.
I'm going to walk over to my office. I just got caught up here.
Oh, Heidi, you're not on mute.
Yeah. I am so sorry, Dr. Saldana. I apologize for that.
No worries, thanks. So I added some slides in. So for folks that have seen me present in the past, some of this might be a little bit familiar, but there's also some new material in here too. And so I'm hoping that by providing some of the foundation on SIC and COINS, in addition to some of our new way of thinking about it, that this will be a really rich presentation for folks. So to begin with, of course, I want to thank my funders, primarily NIH, who has funded this work, and then the SIC and COINS team that continues to grow over time. So our main objective today, as you heard from Heidi, is that I'm going to be introducing the stages of implementation completion, the SIC tool, as well as the cost of implementing new strategies, or COINS. We're going to talk a little bit about how this came up so much yesterday. How can we really integrate SIC and COINS with EPIS? And so I've added some material in there around that, and that's something that we will be talking about throughout the day together. And then also really just focusing in on understanding readiness, and that kind of is a prelude to what our interact activity will be later on this afternoon. So to begin with, this should look familiar to everybody. So I just want to make sure that we are all starting on the same place. So when I'm talking about implementation, I'm talking about the full implementation process that's described by EPIS. So we're talking all the way back from when we start with exploration, on moving this process through all the way to where we establish sustainment. The reason why I think it's important for us to talk about this at the beginning is that oftentimes when we talk about implementation, and when you look at the implementation literature, folks are really zeroed in on this third panel, the active implementation phase. So I just want to be clear that for today, we're talking about that full implementation process. And when we talk about implementation process, why is this important? So there was an article that was done by Per Nielsen back in 2015. And in that, he talks about process models, the point of which is to really help us guide the implementation process. How do we get from A to B? And in that, we want to recognize that there's a temporal sequence to this, and also that there are different stages and phases of implementation that might not necessarily be linear. So this sounds really straightforward, sounds very useful. But when we think about our implementation journeys, oftentimes we have this brilliant idea, right? We're gonna change the way providers and patients interact with one another. We're gonna change the type of innovation or medical delivery device that is being used. Whatever it is, we've got this brilliant idea, and we think we've just got to build that idea, and then we can get it into action. And so we always sort of assume that it's going to be this very straight path. But what we found over time is that, we start to recognize, okay, there are some peaks and valleys, but as we started measuring implementation, we learned that it's even more complicated than this. So you take that, what we thought was a straight arrow, and in fact, implementation is far more recursive. You go backwards and forwards, you have your ups and your downs, and you don't necessarily know what path is going to be the best path for you to get from your idea to your actual implementation of whatever that innovation is. We also want to consider in the implementation process that there are many different agents that are involved. And again, this is a nice, clear way of thinking about our implementation. You start with your developer, they take that knowledge, they create something that they want to share. They've got good evidence, so they engage with a purveyor, somebody who provides technical assistance with them, so that then that can be, disseminated and implemented throughout systems with agency leadership, program champions, et cetera. But again, we know that these relationships are far more dynamic than this. And in fact, what we know throughout the implementation process is that each of these individuals are essential to a strong implementation process, but what they bring to the table really changes over the course of implementation. And so I know that yesterday in our discussion, for instance, we were talking about the role of program champions, and that came up quite a bit. The role of the champion, really the importance of that role is throughout the entire implementation process, but they really start to gain their responsibilities in that process more when it comes to the readiness process and then moving forward. Agency leadership, we see playing a key role in bringing in the decision to adopt a particular evidence-based practice. Agency leadership might take a step back after we've made it through pre-implementation, we have the infrastructure in place, and now it's in the hands of the practitioners who are delivering it to the clients. So it's a very interactive dynamic that we're dealing with that changes over time. And so when we're thinking about measuring implementation process, we're thinking about this recursiveness, we're thinking about these multiple interactions, this dynamic, the dynamic relationships. And so when you're thinking about that, then it gets very complicated in your head. Which path am I supposed to go down? Who am I supposed to engage when and why? And so those are the sorts of things that the SIC helps us operationalize. Before we go there, though, I want to talk a little bit about sort of the foundational thinking behind a measure or a tool like the SIC and the COINS. And so this is from an article that Hendricks Brown and colleagues led, where they were really looking at sort of the full continuum of development of different innovations. So what we have here on the left-hand side is what we all are very used to seeing. And so we do our pilots projects, trying to figure out, can a project work? We do efficacy trials, we want to see, does it work? And then we do our effectiveness trials, where we're seeing making it work more in the real world under real world conditions. But then what oftentimes gets ignored is this idea of, and we see here the EPIS framework is embedded in the dissemination and implementation part of this work. And so what I would like to encourage us to do is to start thinking about that implementation from the get-go. So when we're thinking about, could a program work, not just thinking about, can we get the provider to, get the shot in the arm of the patient, but really the process that it's going to entail. Is that something that we are going to be able to get behind? And I like to say that we can learn from the old in order to inform the new. So if we take what we knew from the old, how did we get there? How do we know that what that first program was that we piloted that we thought was so great, how did we get it to demonstrate its effectiveness? That oftentimes is with identifying the mechanisms and identifying what it takes to deliver that with fidelity. And so I like to think about taking those exact same concepts and applying them to the process of implementation. And that's what I'll take you through here. So fidelity itself, we all think about it from an intervention standpoint, and we know that it is essential for strong intervention outcomes. So we have our adherence to key treatment components, plus delivering those components with competence. And that often is what we think of as leading to treatment integrity. In order to do that, we have to understand what those key treatment components are. And that's where we want to think about the building blocks or the mechanisms. We talked about mechanisms quite a bit yesterday. So the mechanisms for what makes the intervention work. It might be supervision strategies that are being used by a parent. It might be the rate of reinforcement that's being delivered by a practitioner. But whatever it is, we want to understand, why does this particular intervention strategy work? Well, then we can apply that same thing to implementation fidelity. So we think about, what is it performing implementation activities, but performing all of the activities that are recommended and performing them with quality. So instead of intervention activities, we're now talking about things like the implementation strategies that we spent quite a bit of time speaking about yesterday. The goal now is not to focus on positive intervention outcomes. Of course, we need to have positive intervention outcomes because that's a key part of implementation outcomes. But really what we're focusing on here when we think about implementation fidelity is achieving positive implementation outcomes. So to do that, again, we need to understand what is it that makes implementation work? What are those building blocks? What are those mechanisms of action for the implementation process? So that's where we introduce our implementation strategies. So these are the methods or techniques that we use to enhance the adoption, implementation, and sustainment of clinical program or practice. And so this is some work that's done by colleagues of Greg and mine, Byron Powell, also Enola Proctor, and Curtis McMillan. And this is around the how of implementation. And so this is from Byron's work, where he really codified what different types of implementation strategies we draw upon in the implementation science literature. So we have our discrete, our single action processes. We have our multifaceted, where you have a combination of these discrete strategies. And then we have the space that I work in most often, which is our blended strategies. This is where we have multiple multifaceted strategies that are going across a full implementation process. Here it says that oftentimes they have been protocolized. That's part of the definition of the blended strategies, but I would argue that they don't actually all have to be protocolized. And in fact, this is the way many evidence-based practices, particularly in the behavioral health field, this is how we get them from idea to actually serving the population that we're targeting. So we wanted to understand, what does this process look like? How do we get there? What even goes into this process? So I had the good fortune of being at the right place at the right time when I was coming out of my graduate program, and came to work at OSLC, and where they had just been funded with one of the very first implementation science grants awarded by NIH. So this is right when the D&I field was getting off the ground. At that point in time, they had proposed a head-to-head trial of 2 different implementation strategies. However, we did not have a measure of our primary outcome. And so that is great. We're doing this head-to-head trial, but how are we going to measure these 2 strategies? And how are we going to be able to distinguish the difference between them so that we would know if one strategy versus the other had a greater impact? So I had the opportunity to be able to observe many counties across 2 different states. It was California and Ohio. And in that time, really started to operationalize what we were observing that counties were having to go through in order to implement this complex intervention. We were seeing those different agents that were involved. So again, agency leaders involved at one point in time, clinicians, practitioners, program champions, et cetera, and how that evolves over time. Like any good measurement development process, we started out with 15 stages, but then through our psychometric evaluations, really whittled this down, and where we landed was 8 stages. Those 8 stages go from engagement through competency. And then we have a stage 9 that is that we have started some collection on, but it's not on our regular website, and that is for the sustainment phase. The SIC is a date-driven measure, and I'll explain why, but really it is because we want to know when different implementation activities happen so that we can know where they're happening in the sequencing, and we can sort of line them up in the sequencing. And the SIC spans 3 different phases of implementation: pre-implementation, implementation, and sustainment. Pre-implementation, I'd like for you guys to think about as being the E and the P of EPIS. So pre-implementation includes both exploration and preparation before we get into active implementation and then sustainment. And we have conducted psychometrics on that and found that those two, the E and the P, hang together to create our pre-implementation. So this is just a descriptor of what the SIC actually is then. So here are our 8 stages. You see that we go pre-implementation. These first 3 stages involve engagement, feasibility planning, and readiness planning. And then the active implementation phase is where we're hiring or assigning, allocating, identifying our staff, whatever language we want to use for our implementation, training them, getting our fidelity and quality assurance systems in place so that we can be prepared for monitoring. Then this is a graphic that was put together by SAMHSA. But so stage 6, they have consultation starting. I like to talk about this more in terms of where the program launches. So this is where we start seeing our patients, and in addition to that, then receiving our consultation. Then stage 7 is where we have our ongoing services, support and monitoring is taking place. And then achievement of competency. So this is our end goal. This is where we know that our implementation has been success and we're meeting our success metrics. And that then positions us to go on for sustainment. Within each of these different stages, we have different activities. And so depending on how you operationalize your SIC, and we're going to move on to that next, you might have 3 or 4 activities for a stage. You might also have 10, 15 activities for a stage. You can go really, really micro if it's important to you to understand all of those very discrete implementation steps that an agency goes through. But I will warn you that if you go too micro, then you become cumbersome. And so we'll talk about that too. But here are some examples of different types of activities. So again, it's date driven. So we're looking at the date that a stakeholder meeting was held. That's part of the consideration of feasibility stage. In stage 5, we're setting up our fidelity and adherence monitoring systems. And so we have the date that our fidelity and technology is set up. Here in services and consultation begin, we have the date that our first client is served. So again, there are far, far more activities per stage than this, but these are just some examples. The SIC produces 3 scores. You have your duration score. How long does it take for your implementation to take place? We have your proportion score. How many of the recommended activities that have been identified for a particular implementation actually were completed? And then we have your stage score. How far in the implementation process did this particular agency, clinic, hospital setting, whatever group you're working with, advance in their implementation process? I will say, let me go back there. Oops, now I'm going the wrong way. Sorry. Let me go back. Here we go. I will say that for this, I just want to point out that duration and proportion are both, we have found to be highly predictive of future implementation performance and success. And because, and I'm going to talk about our benchmarking process, but because we have done this with so many different sites, we now have some ideas about what is the target duration, or what is the necessary proportion of activities to be completed so that you can still be successful. And this is really important when we're talking about having timelines that might be sped up by funders or resources that are being limited for a particular reason, so we can't complete all of the different activities. And so the SIC really helps us to be able to delineate that. So then here, just a summary of SIC outcomes. We've replicated this multiple times, and we find that it reliably distinguishes from good from poor performers. It can distinguish between implementation strategies. It's predictive of successful program startup. of whether or not a program is going to discontinue in its future, and then whether or not a program is going to achieve competency. So for us, we think about predicting program startup and achievement of competency, stage 6 and stage 8. There are milestones in those stages, and those are the most important for the work we do, the most important milestones that we are trying to predict and really help guide our sites to get to. So the SIC then, there was a desire in the field when we first created this thing for measures of standardized process, again, of milestones and of progression. And so we started to get approached pretty quickly from different groups around whether or not they could adapt the SIC for their particular implementation processes. So we've developed some standardized adaptation protocols, but then also we have what we call customization protocols. And the reason for this is because we do an adaptation if we are helping folks build their SIC from the ground up. So for whatever reason, we've determined maybe it's an emerging practice and we don't really know how it works yet. Or maybe it's a super complex practice that we're putting into a new complex setting. And so we really want to understand at a micro level what it takes to do. When we build it from the ground up, we are adapting a SIC. However, oftentimes what we're asked to do is we're asked to take our existing SIC activities and SIC structure and use that to map onto somebody else's implementation process. In that case, what we're saying is we're customizing it, because all that we're doing is we're really looking at changing the semantics, but the spirit and the definition of each of those implementation activities or strategies remains the same. So I like to say that we've done over 55 adaptations and or customizations because we include all of those and they all contribute to the information that I'm about ready to show you. So when we are doing our adaptations, we want to operationalize our implementation process. Really what this means is that I will ask folks to define what it's going to take to replicate your program. What is it that you think needs to happen if you were to take your program outside of your hands and ask somebody else to implement it? You want to identify the key steps that are needed. You want to clearly define what is expected. How do you know that an activity is actually completed? An example that I use often is of a stakeholder meeting because it's just so clear cut. Folks love to have stakeholder meetings as part of their implementation process, and we know that they are critical to a strong process. Where they happen, how often they happen, why they happen, I think is really important to know because stakeholder meetings are very resource intensive. It takes a lot of people's time. Sometimes there's travel that's involved. The roles of the people that are in stakeholder meetings oftentimes tend to be higher level roles, so costly FTE roles. So we really want to make sure that we're clearly defining what are we expecting to happen in that stakeholder meeting and who needs to be there. So when we are doing our definitions with different groups that we're working with, for instance, you might be working with a project that's taking place in the court system. Would it be the case that if a judge does not show up to that stakeholder meeting, you're not able to accomplish your goals? If so, even though you have a meeting, we wouldn't say that you have completed your stakeholder meeting because it didn't include all the stakeholders in the room that were necessary. I also encourage you to think about ancillary supports or roles that might not be obvious. This came up in our small group yesterday where we're talking about, you want to deliver a medication or you want to deliver a shot to a patient. And so you think about the provider and you think about the patient, but there are many individuals along the way in order for that shot to be able to be administered appropriately, for blood levels to be checked, etc. So you really want to make sure when we're doing a quality approach that we're including all those different roles. As I mentioned before, you want to identify milestones in your process so that you're not just waiting till the end to be able to know whether or not implementation has been successful. And then you also, again, want to define your implementation success to ensure that the processes that you're developing really lead you to that endpoint and not to a different endpoint. And unfortunately, we see this happen quite a bit in our customization processes where folks have an implementation approach, but it's not necessarily leading them to the end of their goal for their outcomes. Some potential pitfalls that I would warn you against is that just because you have a box full of all of these tools and all of these strategies, more is not necessarily better. So I would love to tell people, let's be judicious about the implementation strategies that we are using. With every strategy comes a cost. And so we want to be really mindful of the resources that we're putting in and encouraging our agencies to use. There's also a pitfall of only doing the easy items. Maybe you want to cut costs, and so you do it that way. But when you do that, that decreases variability. We also sometimes have folks who say that they will only include what they know every single agency that they're going to work with is going to be able to accomplish. When you do that, again, now what we're doing is we're sort of guiding our sites towards the least common denominator as opposed to the most robust or the strongest denominator. Cutting corners can be costly. You might think that you're saving yourself time and money now, but if you put all of this effort into an implementation approach that ultimately ends up failing, then that has been a very costly process for you. You want to also, we see that there's a lot of limited consideration of pacing. People think they're just going to do a whole bunch really quickly. They're going to get their program champion. They're going to start their consultation process. They're going to get their leadership engaged, and they're going to get their technology all implemented within the same week. That is unfeasible and unreasonable if you are expecting that you're going to do a good quality job at each of those implementation strategies. So these are some of the things that we like to think about. You also want to think about not making modifications to the intervention because you are trying to accommodate your implementation. I think this is very critical for us to always keep in mind what ultimately is the intervention that we are implementing, what are the mechanisms of action for that intervention, and let's make sure that our implementation process doesn't interfere with that. So we then have a SIC online platform where we do all of our data entry, and it's a reporting system. It can report out all sorts of information for our users. But really what this also allows us to do is this creates a data repository of all of the different SIC data that has been collected. We currently are collecting, this is a little bit outdated, but over 1,950 sites. And we have 50 different evidence-based practices that we are actively working with right now. We have others that have been used before, but are not active in our system at this current time. And you can see that it's crossed a whole bunch of different service settings. So schools, juvenile justice, primary care, hospital settings. For all different types of programs and practices. So what this then allowed us to do is we had a secondary observation that when we look across our SICs and we look at especially our individually tailored or adapted SICs, what we found is that they were more similar than not. A lot of times it was just semantics. I would say supervisor, somebody else would say coach, somebody else would say consultant, somebody else would say team lead, but we were all talking about the same function for that particular activity and that particular role. So with that, we went through, we did a whole bunch of reliability and coding exercises. This was a very long endeavor by my team, but then we developed the universal SIC. So the universal SIC we like to think of as being a measure of implementation fidelity, because it across each of the 8 stages on the stages of implementation completion, we have a set of items, and then you can see out here to the side, the number of items per stage, varies depending on the stage. But these are items that we pulled out across all of our implementations where we found that these are kind of the necessary components in order to implement, no matter what you're implementing. If you're implementing a behavioral health intervention or a physical health care intervention, a device intervention, whatever it happens to be, there seems to be these common core elements. And so we refer to those as the universal SIC. Because we have this SIC repository, we then are able to analyze this. And so we've done universal SIC psychometric properties, and we find that there's good, we use Roche modeling for this. We have good reliability and separation. And what we find then is that we can take the universal items from both our adapted SICs as well as our customized SICs and put them all into a big database where we're able to then look at and evaluate implementation process. What we found from one analysis that was done some months back is that of approximately 1,500 implementations, we see that nearly 64% discontinue. So that is a very high discontinue rate. When we find out where do sites discontinue, the majority of them discontinue in pre-implementation. So 84% are discontinuing during that point of time. We see that a large portion of them discontinue during the engagement stage. I've had some folks say, well, isn't that a good thing? That just means that they don't want the intervention, and they've decided it's not a good fit for them. Yes, but in order to get on the SIC, in order to be entered into the SIC, that means that you've reached out to a purveyor. You've determined that you think that this is the intervention is a good fit to meet your need. And this means that we are not able to provide the type of guidance or the information that is needed to get them to a yes, that they want to actually engage with this. It might be that they determine straight up, it's not feasible, we can't afford it. This is not going to be something that's going to work. And there's probably a combination of that. A junior colleague working with me, Gracelyn Cruden, is in the process of really exploring this engagement stage and what happens here. We see that we also lose folks in the feasibility assessment stage and then also in the readiness planning stage. However, if you do make it through pre-implementation, so these 46% that make it through pre-implementation, about 55% of them will make it to program launch. So that means making it to pre-implementation still doesn't get you all the way there, right? You still have about a 50%, 50-50 chance that you're going to make it to your program launch, and then that you will achieve competency in delivery of your program. And then we see from the full total, what does this mean? If we take it out of those that just make it to pre-implementation and start again with our denominator or our 1,500, we get about 12% to make it the competency. So we really want to help move the needle on this. And so when I think about pre-implementation, I think that this is the greatest opportunity that we have to move the needle on success, and particularly to promote equitable implementation. And for me, this is what I'm most passionate about. I want to figure out what is it that we can do to get these really robust gold standard practices delivered to individuals that are in low resource settings. How can we do that? By providing them with the best implementation processes and approach, but in the most resource sensitive ways, so that they are able to get the value out of these implementation activities with limited waste. So this is where we'll think about the universal SIC as a measure of implementation fidelity. We've got our 8 stages that hold true across all different implementations. We have those 46 activities that we are thinking are necessary for the majority of implementations that we've been engaged with. This creates a standardized process for us to be able to consider things like implementation fidelity. So this is a figure that Greg showed yesterday that Dylan Wong, individual who's working with us, a junior individual working with us on our team, put together. And this is in progress. So this is a paper that's under development. But this really shows how these different stages that I've just been talking about map onto the EPIS framework. And so here we can see again where we have exploration being more with stages 1 and 2, but then really moving into preparation, a little bit in the feasibility planning stage, but really when we get into readiness, moving into our active implementation phase, and then moving into sustainment. And so with that then, we are not the first people to do this, obviously, but there are other folks that are doing this, and we've learned. So in addition to the JJ Trials work that Greg mentioned or just yesterday, of mapping on SIC and EPIS to really build out a robust implementation fidelity process, we also have some work that's been done by colleagues of ours around a program, a restorative practice program for youth in the school setting. And we have a program that's being done by Kate Elkington. She's in Columbia, and this is an opioid drug court project with adult. We have our colleague Byron Powell in team. His COAST-IS process uses both EPIS and SIC together there in operationalizing. This is for trauma-focused CBT. This is looking at implementation fidelity across the field of different interventions and for learning disabilities. And then it's been used recently by a colleague of mine in Chicago, looking at a Housing First project. This is a pilot project. We're trying to determine what the appropriate implementation process would be. So all of these are examples of projects that are out there right now that are using the combination of EPIS and SIC to be able to build an implementation fidelity process. So the SIC itself has, I'm just doing a time check here. The SIC itself, we spent so much time yesterday talking about context. We collect different agency demographic characteristics for us to be able to understand the context in which this implementation is taking place. And then for pre-implementation, what I'm going to focus on right here, we have just our basic pre-implementation activities from that universal SIC. So this is not rocket science, right? This is engaging whoever it is that you're engaging with your technical assistance provider, the developer, expressing interest, gathering more information, and then ultimately saying, yeah, we're agreeing to implement. We need to have some additional information. I also want to just remind folks this is nonlinear, so it might be that they get that cost information sent first before they agree to consider. This happens in different ways depending on the implementation. But what we know, these are some updated statistics. Some folks might have seen similar slides from me in the past, but this is updated. Zoe Alley, who is a junior member of our team, has been working on this and doing some really terrific work. And what we see is that if you only do engagement, you still only have an 80% chance of starting your implementation. And so this lets us know, we just have to tell them about it. We just have to show them that it works, and then they will come. Well, now I think we've got lots of evidence from the field that that is not true. So then if we move on to stage 2, where we're doing our feasibility assessment, again, just these key activities, but your feasibility assessment might be far more robust than this. But you want to do an assessment of whether or not this is going to be feasible. You want to check in with your stakeholders, the folks that need to be involved. Do they think it's going to be feasible? You want to identify your program champion, who's going to really take this on, particularly before your readiness process. And when we do that now, we see that we have a much bigger or much greater likelihood of starting our program when we're including those feasibility assessment activities. But then readiness planning. So readiness is what we're going to spend more time talking about this afternoon. But we have found that the readiness process is incredibly important and is the most predictive of whether or not you're going to launch a program. This includes things about, like determining your cost calculator, communication plan, another stakeholder meeting, making sure that you have all of your documentation written. I can't tell you the number of folks that don't write down their implementation plans, and that causes complications in the future. So now when we do this, you see that we get a much bigger bump in our potential to launch or to start our program, to achieve program startup. So really it's the combination of pre-implementation that we're most interested in. Of importance is the amount of time that you take to do this. And so this graph shows different implementations where they all made it through the pre-implementation process, but we see the speed in which they did was predictive of those sites that discontinued. So if you took longer in your pre-implementation process, you were more likely to discontinue than those that didn't. Word of caution, though, that's a little bit confusing because I will also say that you need to take your time. If you go too quickly, we also see rapid discontinuation happen. So the way that you get there can look very different. This is the most efficient implementation process that we have. And so this example, this shows us, and I know this is a little confusing, but at the very least, you need to spend 2 months in your pre-implementation process. And so we know if you spend less than 2 months in that process, you're gonna need to do some course correction later. But the most efficient process is doing implementation activities by the 2-month mark, then really picking up your pace and doing things so that by the 5-month mark, so this is what we say is it's a fast. This is the fastest pace that's available to still be able to be successful in starting your program. But all programs don't need to look the same. This is an example of a site that achieves 40% of their activities by the 2-month mark, and then they sort of peter out they start to go down. So they start to lose the potential. They stall out, and our predictions would start to go down that they are going to launch their program. But then they really pick up the pace here in month 6. They pick up at a nice steady rate, and then they're successful. Here's an example of one that, again, she achieves that 80% mark by the 2-month mark, but then they just sort of even out because they achieved so much within that really key ideal range. They're able to be successful even though they slow down their pace. And then here's an example of a slow starter, but then picks up the pace and goes really steadily, and then they're able to launch their program. So the point of this is to show that there are many different ways, many different paths that you can go down and still be able to manage to achieve success. But one of the key takeaways that I hope you hear is what we know from our work is that if you do not have a solid pre-implementation process, this graph shows us that even if you have the most ideal active implementation process, which means you've hired the best people, you've trained them really well, you are serving your target population, you're serving your target population well, in the absence of a quality pre-implementation where you built that infrastructure, doing your cost calculators, determining your stakeholder engagement, coming up with all of your different protocols for instance, your on-call protocols, device delivery protocols. In the absence of that, even with the best, most active implementation, we will not reach sustainment. And so this lets us know that pre-implementation is critical. So the implementation path that you choose absolutely impacts the resources that you also will need to use in completing that. Obviously, different agencies select different paths for different reasons, but it does impact resources. So here we are back at the EPIS model again. And if you recall from yesterday, across each of these 4 phases, funding plays a critical role. It's one of the critical determinants that is listed in the outer context. And yet funding is oftentimes ignored when we're doing our practice selection. So we developed the cost of implementing new strategies. Mark Campbell really has taken the lead on this for my team. He is a master's level economist that has worked with me. And so COINS stands for Cost of Implementing New Strategies, and it is a tool that is an adjunct to the SIC. And so if we think back then to our 6 stages, in order to do the COINS process, what we do is when we operationalize our SIC activities, we also determine basically, do we think there are going to be direct resources that go into this? Who's going to be involved in that in completing those different activities? And then we take that with the Bureau of Labor Statistics so that we can, so for instance, a nurse here in Eugene, Oregon might not make the same as a nurse in New York City. So we use the Bureau of Labor Statistics to come up with national averages of our FTEs. And then we put that in and we feed that into our COINS tool. And then again, the SIC website has reporting that allows us to be able to spit out then the assessment of the number of hours that are taken to complete those activities, the fixed fees that are required to complete those activities. So some common pre-implementation costs that we see are, cost of phone calls, of the stakeholder meetings, even identifying your program champion or identifying your key roles takes resources, going through an organizational readiness process. All of this takes time. Sometimes it takes supplies, sometimes it takes travel. And again, you want to be mindful of who's in the room because those FTEs can really start to add up. Common active implementation costs that we see. Now you're hiring your staff, you're training your clinical staff, you're training your agency staff. You might have to train your receptionists or other support staff. You have your clinical supply costs, again, more travel costs, your overhead costs. I mean, you've got your 24-hour phone access. You have to put roofs over people's heads. For the interventions that I do, they're community-based interventions. So there are mileage costs that really add up. And so those are some common implementation costs. And then sustainment costs, these are your ongoing certification, your retrainings, your re-engagement, your ongoing booster trainings. And so for this, for the coins, when you feed this into our system, what you do is we have these reports that come out of it. And so what you're able to see is you're able to see here in the background, our direct dollars for each of the different activities. And then here in the foreground, it's just a pop out to show that we can see how that relates to the number of hours that are taken and whose time is it? Is it the site or the agency's hours, or is it the county or the implementing location or region's time that's being taken? Because a lot of times, depending on the resources of a particular setting, they're having to balance which implementation approach or strategy am I going to use. I think this one seems the best, but I can't afford it. But if I can do this one, which is equally good, I might not be able to afford it, but I have the time that is needed, and I have the people, the bodies that are needed to be able to implement that particular strategy. So we're going to go with that one because we know that they both are valuable for this evidence-based practice, but this is one that I can do feasibly. So COINS allows you to disentangle your hours from your actual direct costs. It also, this is just an example. I was trying to just find an example real quickly to show you more practically some of the utility of it. So using COINS data, we were able to take from this head-to-head trial and determine what were the number of youth that needed to be served in order for a program or an agency to recoup their startup costs that they put into their implementation process. And so here we were able to see that they needed to serve approximately, above 10, less than 15. So, around 11 or 12 youth, and then they could start to break even. And so this is, again, just an example of what types of data you could use. I mean, you can do all sorts of things with this cost data. This is just an example. But then there's this link between resource use and readiness. And so what is this link? And so strong readiness, as I hope you've seen from what I've talked about so far, is the best predictor of program startup. It contributes to sustainment. So again, if you are putting resources into an implementation process, we want it to be successful in starting up the program, and we want it to be a program that sustains. So that's one of the things, is that because we know that readiness predicts that, then we also know that strong readiness is going to help us save resources in the future. We know that strong readiness should help us be really thorough with our implementation process, but also efficient. It helps us predict and prepare for the challenges that we think we might encounter throughout our implementation process. And it really positions us for pacing of the growth of our program. So all of this has resource implications. So we're going to go through together in our Interact section this afternoon, this readiness worksheet that we have put together. And what I ask you to consider, whether or not you participate in the Interact, but when you're thinking about defining readiness and defining your readiness activities, we hear so much about readiness in the field. But I really want you to think about what are those activities that go into readiness in the readiness process. And these are the things we want to think about. Obviously, you want to name it so we all know what we're talking about. You want to define it. What does this mean for your implementation process, and what function does it serve? If we don't know why it's important for the implementation process, then it might be a waste of resources if we're putting our time and effort into it, but we don't know why. This also speaks to a point that somebody made at the end of the day yesterday when they were talking about what is it that we do to keep the work going after we've left the premises. Well, one way that we do that is by making sure that folks understand the importance or the value, the function of what it is that we're doing. We want to know who's involved and why are they involved. We want to know when in your process an activity is important to take place. Again, with the pacing is really important. We don't want everything piled up all at once. We also want to spread things out and be mindful of our budgets. We want to know, when do we have room in our budgets to engage in this particular readiness strategy? And then what are the action steps that you need to take so that you're sure that you're ready? And then, just as a little teaser for this afternoon, all of this work, we're going to talk about how do you take the implementation process and operationalize it when we have these multi-level implementations where we have the implementation inside an implementation inside an implementation. We're doing that right now. Greg and I are working on a project together that Greg is the PI on, where we're looking at this. And then we have we're using the SIC to guide facilitation. So instead of just measuring facilitation, now offering guidance. I have a current RO1 where we're doing that with purveyors, and we've just proposed one where we would be doing that with direct frontline staff, agency directors, et cetera. We are now, again, as I've said, we've built out our SIC to the sustainment phase. And we have a module that was funded with COVID dollars to be able to assess the impact of COVID on implementations. But really what that allowed us to do is to be able to build a outer context module. So more on that later. In the meantime, thank you very much for your time.
Thank you, Lisa. That was very informative and very helpful. And I know that several people have questions that they've already put in the Q&A and have also upvoted, but I want to encourage everyone to continue adding in questions and upvoting ones that are of interest to you. I'm going to start with the Q&A by just saying the one that has the most upvotes, which shows that if there's something that's really interesting to you, you should upvote it. Dr. Saldana, can you explain more about what you mean about including only easy items decreases variability? This is in reference to the slide about pitfalls in operationalizing the implementation process.
Yeah, great, thanks. That's an excellent question. So what I oftentimes hear when we, so my team and I, as we're working with other teams, you know, worldwide to operationalize their implementation processes, when we're asking them to take us through the process of what's necessary to implement, they'll take us through a process, and then a lot of times what we hear is, oh, never mind, don't include that activity, such and such agency won't be able to do that. Or, oh, never mind, don't do that activity, we know that this group of providers won't do that. And so when we're doing that, what we're doing is we are modifying our implementation approach and making it easier so that we're creating activities that everybody can do. But what that's preventing us from being able to do is to be able to determine the best and the most robust implementation process that's necessary. Sometimes I've seen happen in the past when you do that, it removes all variability. You're not able to distinguish any differences between your different agencies or your implementers, and yet you're achieving very different outcomes. And so we'll get told like, oh, the SIC doesn't work because we got different outcomes, but it shows that they all did the same thing. Well, the reason it all did the same thing is the way that it was operationalized, and we removed that variability. So that's what I'm talking about. It becomes less informative. It is totally fine if you're just trying to come up with a recipe for people to follow, but if you're using it as a tracking tool to be able to determine like differences between implementations, then it takes away that variability.
Thank you. I think that seems to make sense, and I appreciate the discussion around why just using the easy ones would not be particularly helpful. So the next question that I'm going to share is the operationalization, hard for me to say, breakdown of the implementation process, what it will take to replicate the program. Seems very similar to the development of performance objectives used in implementation mapping. Do you know of any examples that have combined implementation mapping with SIC? Each example, design strategies with implementation mapping while simultaneously customizing the SIC.
Yes, the short answer is no. I do not know of any examples like that. I do know that, so Byron, Maria Fernandez, and I have all talked about this, and we've all, so we've enjoyed some conversation, discussion about future directions, but at this point, I don't know of anybody that has done that. That is absolutely not to say that that has not been done. I just did a quick Google search last night when I was looking for some references and was really surprised to see there's a lot of work happening out there, exciting work happening out there that I wasn't aware of. And so perhaps, but not that I know of.
Some good future work. Okay, so the next most upvoted that's gotten a lot of traction last minute is, can you use the SIC to guide implementation within an RCT study? This means that the innovation is still at the level of promising practice.
Yeah, so great question on many levels. So first of all, yes, the SIC as a measure of implementation process and milestones does not need to be limited to evidence-based practice. I think that the EBP portion of it really is more around the field and the direction that the field goes in different times, depending on who you're talking to, as to whether or not what it is that you're implementing needs to be evidence-based. But the SIC tool itself can be used even for emerging practices. We've used it for, it's been written into a number of K awards. And so for folks that are developing practices, again, with that idea of thinking of implementation from the get-go. We also have a grant that's under review that is wanting to look at that more specifically. But we also have the current active grant that I had mentioned, where we are using it to actively guide implementation during implementation with real world purveyors for 3 different evidence-based practices. So no, it doesn't have to be an EBP to the first part of the question. Yes, it can be used as a facilitative process in the midst of an evidence-based, of a trial without any problem whatsoever.
Thank you. Heidi, do you want to add something or ask the next question?
Yes, I think this is a question that dovetails nicely and also has gotten lots of love in the Q&A box. Given that the SIC is data-driven and date-driven, can you use it retroactively on a project that has already started? And if so, how?
Yes, okay, this is another excellent question. And most definitely, I will, full transparency, the data collection becomes more cumbersome when you are doing retrospective data collection, but it definitely can be done, has been done by ourselves and a number of other groups. A lot of times we'll do retrospective data collection on the SIC that we develop. If we're doing an adapted SIC, we'll do retrospective data collection on up to 15 teams that have, and then we can use that to verify and validate the psychometrics on that. And so, yes, it's done frequently, commonly, but you have to go digging. And sometimes you're digging in like bankers boxes at the bottom of a basement somewhere in order to get that information. So, yeah.
Thank you very much. There are a few questions around that I think kind of tie into the previous question about using SIC to plan implementation in an RCT. There's a question about examples of how SIC has been used within a hybrid effectiveness implementation trial to assess implementation outcomes while efficacy of the intervention is still being determined.
Yes. So again, the SIC as a process, because it's a process measure, it doesn't matter where in the developmental process the intervention is. Keeping in mind that if it is in the early developmental phase, so if it's, I mean, probably a little even earlier than the efficacy phase, that's where you want to be careful about merging your implementation and your intervention strategies. And absolutely, they can overlap, just being really clear that that is what you are doing, because once you go down that path, that means that your intervention now cannot be decoupled from your implementation approach. And so in the future for scale up, that might cause some challenges. But in terms of the functionality of the SIC, it poses no problems whatsoever.
And then sort of along those same lines, there's a question about whether SIC can be applied to an intervention after the fact, or whether it can inform intervention development as a way to ensure better future implementation feasibility. It sounds like you're cautioning us against that. But no, actually quite the opposite. I think yes, definitely to use it as you are developing the intervention, just being careful, being mindful in that process. But I actually would encourage you to do that. I think we should think about implementation from the outset, before you've even done your pilot project for your intervention. I think we should be thinking about it from the very beginning. I think that's one of our biggest challenges with interventions, that we have these amazing interventions, but the implementation approach that is necessary to get them into practice is sometimes complicated or not well understood. And so I think as much as we can sort of preempt that, that's going to help us. And there's a lot of love for a question about clarifying how the SIC activities are different from implementation strategies.
Yes. So Byron and I have talked at length about how we need to eventually write this paper. They aren't if they aren't, but they are if they are. And so the activities on the SIC very much include implementation strategies. And I would say more often than not, they are implementation strategies. There are other things, though. There are other metrics that if you saw a full SIC, you would see that aren't necessarily implementation strategies. So for instance, wanting to know how many people are in the room versus the function of having those people in the room, right? And so there are some elements of the SIC that are not strategies, but all in all, more often than not, that's what it is. It's a process of strategies.
Can you talk a little bit? You mentioned the importance of engaging your stakeholders at various points in the SIC process.
Yes.
How do you secure proper composition of your stakeholder group? Approaches or sound scientific methods?
Yeah, so we are firm believers in participatory based research. And so the interventions that I myself personally do, we have a saying that they can only be as good as the community, the communities that we're working with and the community involvement that we have. And so I think that could be a whole other conversation. I've got a whole training on stakeholder engagement, but really wanting to make sure that we are engaging folks. Again, I know I keep saying mindfully, but you're really mindful about who you're involving, when you're involving them, and why, and making sure this is of value to them as well. I feel like sometimes we, as researchers, we take a lot. And in implementation research, I think it is as important, if not more important, for us to give out. And so I think really wanting to understand what is the stakeholder going to get out of this, identifying that link, and then identifying for them, like, is this a good time for them? It might be that this is what we need in our implementation processes. We need this now. But if this happens to me all the time working with child welfare systems, if it's part of their legislative session, I'm not going to go to them and ask them to review something that's going to take up hours of their time. But we've worked together long enough that we built that relationship, that we know that. And so we trust one another. And so I would say taking the time to really understand their workflow, to really understand what's valuable to them, and then how that could help improve or keep your implementation process on track. I realize that's not a very satisfying answer, but I'm happy to talk about this offline if anybody would like.
And speaking of keeping implementation processes on track, how does the expectation of time for stages differ based on if you're doing the first implementation versus scale up or scale out, and with diversity of targeted settings and populations? And then sort of similar along those lines, are there specific strategies that are critical for that last 9th stage?
Oh, interesting. Okay. There's a lot to unpack there. So the first part of that is, now I've already got myself confused. Let's go with the second part of that. So the second part of that for stage 9, yes, the most important thing and part of the reason why we haven't released stage 9 yet is because of the cyclical nature of needing to prepare for sustainment. So although we have activities that have now been verified and validated across different purveyor groups and developer groups, where we're operationalizing what happens during sustainment after competency, doing things like financial viability plans, ongoing stakeholder meetings, things like that, making sure that you're checking in with your referral sources, making sure that you do an assessment of your population needs, that you're still meeting the needs of the population, because that might change over time. So those things are pretty not easy, but they've been operationalized. What makes it hard from the SIC standpoint is that you need to go back and do those in previous stages over time. So similar to what we've been seeing with EPIS. And so from a modeling standpoint for our predictive algorithms, That is something that we are continuing to work on. But in terms of what those activities are, I'm very happy to share those with anybody that would be interested. We have those. And then Heidi, can you remind me the beginning of that question?
Yes, it's how is the timeline for the
Yes.
implementation different based on where you are, whether you're in the primary or scale up or out?
Yeah, and so there's a paper. I don't know, Felice, I'm not sure if you were putting the citations in the chat, but there's a paper that I'm the lead author on with Ian Bennett. It's on perinatal depression, and in that paper we talk about the adaptation process, and we talk about the difference in duration. Depending exactly on this. So depending on when they are in the process of developing their implementation approach versus now when they're using it and scaling it up more broadly. And so I don't have anything to say in terms of like, is there like a rule of thumb? But I absolutely will tell you that it is much longer when you're first doing this. And then we develop our efficiencies over time. We figure out what are some of those implementation strategies that can take place at once. One big thing is when you have your stakeholder meetings, making good use of that time. So if you can knock out 4 or 5 implementation activities in a really good quality way in that stakeholder meeting, all those things happen on one day. Well, then that of course decreases the amount of time, your duration that you're taking. So there's not a hard, fast rule, but we definitely see an impact.
And can you speak to some of the challenges trying to balance the implementation processes with funding timelines and with community-based participatory research and the stakeholder engagement?
Yeah.
And
yeah, I would say I wish I had the magic answer to making this work with funding timelines. I do not. And a few years back, pre-COVID, right before COVID, actually, I was sort of on the circuit of talking to different funding agencies to try and help encourage the funders themselves to think about the value of pre-implementation. I think what we see and what I hear from our different constituents is that one of the biggest challenges is that once an agency or a clinic, a community area, region receives funding for a project, there's an expectation that they are going to start delivering services at a much faster pace than what is feasible for a quality implementation process. And so I've been trying to work with funders on that. I will say that NIH has taken some of that into consideration. There are some things that they're doing with different mechanisms now, particularly NIDA has a two-pronged mechanism so that where you can get started with using more of an R34 type of an approach for your pre-implementation activities. And then if you're successful with that, then moving into your R01 where you're doing your active implementation approach. But it's a challenge. That is an ongoing challenge. In terms of challenges with the community-based participatory research, I think one of the biggest challenges, I say, so I'm a clinical psychologist by training. I'm not a practitioner, but I use my clinical psychology skills in those meetings and in those interactions. And so when you're bringing community members together and trying to create a shared vision, sometimes it's wonderful when it works out that we're all there with the same goal in mind. That is not always the case though. And so when that's not the case, you can imagine how that also impacts your implementation process and impacts different members that are involved in that community-based participatory research. Their thoughts about how resources should be used, and their thoughts about what is or is not valuable for their community. Sometimes there are differences there. So I would say that's the challenge. The challenge is really making sure that we elevate all the voices that are at the table and everybody gets that opportunity, and then helping folks move towards consensus. We want to make sure that we take our time at that. I have absolutely seen and witnessed stakeholder meetings where that gets pushed through, and those ultimately end up being implementations that are not successful.
I think we have time for one more question. And the thing that has the most love right now is, can you tell from SIC whether folks that discontinue at some point in the process are discontinuing because of something related to the intervention itself or related to the implementation strategy.
Yeah, I am not able to tell from the SIC if a discontinuation happens because of the intervention. But we absolutely can tell. And that was one of the primary reasons why it was originally developed, was to be able to identify where in the implementation process people get stuck. What we tend to see for discontinuing is that they get stuck at a particular stage on a particular activity or set of activities, and the duration will start getting further and further out, and then they discontinue. So we can tell when they've started working on a particular stage and then aren't able to see it through. And so that, to us then, from a developer standpoint, is a signal for us to work with the developer or with the technical assistance provider to say, this is an area of need for your implementation process. Either there's something that we might want to adjust with your procedures, or this is a place where we would encourage you guys as providers or purveyors to provide increased technical assistance and support and guidance to your agencies, because this seems to be where folks are struggling.
Thank you very much, Dr. Saldana.
Thank you so much, Heidi.
I think this concludes our morning session. We're going to now have a very quick 15-minute break, and I'll encourage everybody to come back after this break to join us in the same Zoom webinar platform for our next two panelists, which is going to be very exciting. So 15 minutes, and I look forward to seeing you all back here.